Healthcare reform, the issue has taken center stage on Capitol Hill and also stirred up debate in the Garden State. As President Barack Obama works feverishly to push the plan, critics say it's the cost of the plan that will ultimately make everybody sick. Jennifer Jordan has details on a public plan that could help the uninsured here in New Jersey.
Officials say it's a critical number. 1.7 million New Jerseyans do not have health insurance, but U.S. Senator Robert Menendez is hoping a new plan will help bring those numbers down.
This one helps me more. It's cheaper.
Kersey Rodriguez gave birth to a healthy baby girl 1 month ago and received prenatal care here at the North Hudson Community Action Health Center in Passaic. Rodriguez currently receives Medicaid, and medical services for her are free. She says receiving care through a private physician was something she could not afford.
They attend me very well. Me and my daughter right now is a great help to us.
In the greatest nation on earth, access to quality and affordable health care too often just doesn't exist.
Making health insurance more accessible and affordable is the goal of a new health care reform public plan bill in Congress. U.S. Senator Robert Menendez says the goal is to increase health insurance options for Americans.
If your husband or wife has a swollen knee or if you feel discomfort in your chest, you should never be put in the position where concerns about the cost of seeking medical treatment can affect the health of our loved ones.
Menendez says the public plan would also create competition for private insurance companies, which would ultimately drive prices down. The senator was joined today by New Jersey union leaders and workers, as well as a small business owner who was not able to offer insurance to employees because of high insurance costs.
It's not right that small businesses pay more for health care. We need affordable, predictable costs and a plan that we can budget for.
When asked how an already strapped government will foot the bill for reform, Menendez says rolling Bush tax cuts back and tax revenues from alcohol sales are options currently on the table. So how soon could this plan become reality? Menendez says the House and Senate could vote on the bill as early as August. In Passaic, New Jersey, Jennifer Jordan, My 9 News.
And joining me right now, Weissman, who is the Health Care Campaign Coordinator for New Jersey Citizen Action, and Gregg Edwards. He is president of the Center for Policy Research of New Jersey. Welcome to you both. Now, of course, it's a cost. $1 trillion maybe in a decade?
Well, I mean, we're already spending an incredible amount of money on health care in this country, in this state, and quite frankly, we can't afford not to fix the health care system. It's crushing the bank accounts of families across New Jersey, of small business owners who can't afford the skyrocketing cost of health care from year to year. So we really can't afford not to fix it, and quite frankly are already spending far beyond the projected cost in waste and inefficiency that we could really rein in.
The problem, though, Corianne, is that I haven't heard from Washington any specific proposals about how to actually reduce those costs. All we've heard thus far is expanding the provision of health care to a larger population will just increase costs. And I think we have to be skeptical about how the government goes about cutting costs. For example, the Medicaid program, they've cut down significantly in reimbursements to doctors. What that has caused is doctors unwilling to participate in the program. So while we claim we're trying to increase access to care, the Medicaid program is actually moving in the opposite direction because fewer and fewer doctors want to participate. And then on the hospital side, since they can't get complete reimbursement for the care they provide, they end up shifting those costs to private payers, so people who currently have insurance and can barely afford it now have to pay even more because the Medicaid program shortchanges them. So government is not very good in the healthcare arena at all, I don't think.
And hospitals and pharmaceutical companies already in dire straits in a lot of areas. I mean, how's this going to help them?
Well, I mean, at the end of the day, the people that we're looking to help are the families and small businesses who are struggling with the cost of health care. And one of the reasons health care is so expensive in our country is because people don't have access to primary care doctors and can't get preventative medicine when they need it. So that medical conditions that would be much less expensive, much less costly to treat early on, end up becoming much more severe conditions that are much more expensive to treat in the emergency rooms. And then, as you said, the cost is passed on to the rest of the consumers. So we need a healthcare system where everybody has access to good quality healthcare that's affordable. And so people can pay for the healthcare they need and get it when they need it, instead of allowing things to progress to the state where they're just crushing everybody with cost.
I do think, though, that because in New Jersey, the presence of the pharmaceutical community is so critical to this state from an economic standpoint, New Jerseyans need to be concerned about how Washington deals with this issue, because, again, if the decision is made to reduce costs in an artificial way, to preclude the provision of drugs, to say you only have access to certain drugs, or to artificially cap the prices of those drugs, means that the pharmaceutical community won't be able to engage in innovation. Well, that's bad for healthcare in general, but as the industry has to constrict because of these cost constraints placed upon it, then I think New Jersey is going to see higher unemployment, which then has a ripple effect all across the economy. So, again, my concern would be, we've seen how government responds to these problems in the past when it tries to, quote, control costs, and it's not been very effective because they're not really controlling the costs, they're just shifting them to other places.
But you made a good point. Can we afford not to do it?
Oh,
at this point? Look,
you said $1 trillion, and I would bet that the program is going to be a lot higher. Look, we do have a problem with uninsured folks. That's not to say they don't have access to health care, but it does mean they don't have insurance for it. But that number is not so significant, and the problem is not so large, that we have to basically recreate the health care system. We could be dealing with those problems in more specific ways, and I think in less costly ways.
Health care reform has been tried in the past, and it failed. What makes us think it's going to work this time around?
Well, I think that we have really reached a crisis point. It is just unsustainable for this country to continue spending the amount of money we spend on health care. Insurance company consolidation basically has meant skyrocketing costs for consumers across the board. And what we would like to see is a public health insurance plan, so that we're not artificially lowering costs, but we're in fact driving down costs across the healthcare system through competition on a fair and level playing field with the private industry, so that people would have choices. And if people have private health insurance that they like, we think that's good and we should keep it. But we do think that 50 million people in this country without insurance is a very, very big number, and that number is growing fast as unemployment is rising across New Jersey. It's nearly 1.7 people at any given time without health insurance. So we're looking at very incredibly large numbers of people across this country who don't have access to health insurance, and again, it means that they don't have access to primary and preventative care.
Actually, I think when you look at the number of people who don't have access to insurance or can't afford it, the number of those folks who are really in that position, who don't qualify for a government program, right, but make too much, but not enough to buy insurance, that number really is about 8 million nationwide. That is not a difficult problem to solve. But let me tell you what a real crisis is. The unfunded liability of the federal government's two big insurance programs, Social Security and Medicare, is $107 trillion. There's the crisis. We should be fixing that problem first before we create new entitlements.
Thank you to you both. We just ran out of time. I appreciate it. And if you have ideas, what's important to you that you want to see, talk about here, please log on to my9tv.com. Click on Public Affairs. We want to hear from you. That's all for today's show. Thank you for joining us. For My 9, I'm Cora Ann Mahalik. See you next week on New Jersey Now.